When I started with the coalition, I was excited to join an organization that has spent 20 years providing and delivering compassionate, supportive care to kidney patients. It ended up being just a few days before our nation would be transformed indefinitely by the COVID-19 pandemic and the rising social justice movement. These two major events have underscored the ongoing health disparities deeply felt by chronic kidney disease patients.
Some health disparities that I see within the work environment, one being cultural competency. Our patient population here is very diverse. And so what comes with that too is language barriers. With language barriers, you run into issues of proper patient education. Another disparity is support systems. Is family involved? What's their income? Do they have insurance? It's all these issues with access to care that I see.
Unfortunately, there are disparities in caring for patients with kidney disease, and more specifically, my research is focused on racial and ethnic disparities for patients with kidney disease. And so specifically African Americans, Latinx patient populations, Native Americans are disproportionately affected with end-stage kidney disease, partially due to the fact that there's a disproportionate burden of diabetes and hypertension, which are the number 1 and 2 causes of kidney disease.
Well, supportive care is exactly what it sounds like. It's a critical layer of support for our patients, their loved ones, the medical teams that are taking care of them. And specifically, it's about really re-empowering people in a health system that tends to make people feel more disempowered. And some of that feeling of disempowerment also has to do with just grappling with the uncertainties that are inherent with serious illness. I think we're, as a society, seeing that a bit more with the COVID-19 pandemic.
At the beginning, medicine didn't know how to save people. We could put many people on respirators, but it didn't save all of them. And it became very clear that the science of medicine is very, very important, but it needs to partner with what we think of as the art, which is those healing arts. And one of the ancient healing arts is walking with people through the valley of death.
I think the hardest part about caring for somebody during COVID-19 was the fact that they were very much alone. I remember rounding on one dialysis patient. She was a young woman. She was 39. She had so much of her life ahead of her, and she was just really, really scared. And I looked over and she had her phone next to her in the bed, and her cousin was talking, but I could hear that he was passing it on to somebody else. And I looked, and her phone had been on for 4 hours because she was so scared of being alone. The only sounds in her room were the sounds of her oxygen machine and the sounds of the dialysis machine. So without the machines and the nurse running the machine, she would have been really, really alone.
Nurses also engage the loved ones in this conversation as well to prepare them for the eventuality that it's possible they may be in a place of making decisions for their loved one. And they need to understand what that is. They need to understand what it is the patient wants or doesn't want. And ideally arrive at a consensus around that within the family long before the need should arrive, if it does. And the nurse has a role in that.
I hope that the tools that we're developing and the research that we're doing is going to provide people with the best care, and that we can help distribute these tools and resources so that everyone has equal access.